Hello and welcome to Early Bird by Amerisleep. My name is Dr. Devon Hoffman, and today we're going over if a new mattress can cause back pain. We've done the research, so you don't have to. So to start off, here are 3 signs that your new mattress might be causing more pain, or if you know it is, we're going to be going over some treatment methods later in the video to go over some adjustments that we can make. Now the first one is persistent discomfort. Now this one's somewhat obvious, but if you are having persistent discomfort, you can't get comfortable, you're having some pain, you're having some issues with your mattress, this could be a sign that your mattress might not be a good fit for your body, might be too supportive, not supportive enough, or it's just old and you're not getting the support that it used to get. And if it's getting worse and worse, this would be a sign that you might need a new mattress. Sign number 2 is the lack of the adjustment period. So it is normal for a fresh mattress right out of the box to have some sort of adjustment period. I would say 1 to 3 weeks is a good amount of time to allow both your body and the mattress to adapt to different levels and basically get to the point where that you're having the good amount of firmness for your sleep quality. And if you're past this range of 2 to 3 weeks, this is a good time to say, okay, I've adjusted, the mattress has been broken in of some sorts, and I'm still having the issues. It's a good sign that your new mattress might not be a good fit. The sign that this new mattress might not be a good fit is if your pre-existing back issues worsen when you get this new mattress. Now, Amerisleep has an 100-day return policy on their mattresses, which is awesome because it lets you try and basically see if your new mattress is going to cause more pain or if it's going to actually help relieve some of the pain that you're having. So this is a good sign. If your current back pain goes from, let's say, a 2 to a 4, then this is a good sign that it might not be a good fit for you after your adjustment period. If you already know that you have pain and you know it's not a good fit, but you want some other alternative ways besides getting a mattress, here are a couple ways that you can help relieve low back pain for sleeping in different positions. For back sleepers, using a pillow under the knees can be a great option to help relieve pressure in the low back and help offload some of the parts of the spine to basically put your hips in what's called a posterior pelvic tilt and allow for some of the distraction to happen between the vertebrae so there's not as much pressure. Now for side sleepers, you're going to want to be using a pillow below the knee and the arm to basically offload some of the tilt that happens if our knee is higher and not supported. It'll pull on our pelvis, which can actually help cause which can actually put our hips into a rotation and cause some low back issues. Lastly, for stomach sleepers, you're going to want to put a pillow ideally below the pelvis and the stomach to help elevate them and actually provide a little bit of relief so that you don't have a huge arch in your back if we're sleeping on our stomach without support. Lastly, here are some factors that can contribute to back pain with your new mattress. The first one is inadequate support. So a lot of times our old mattresses or even our new ones can be too soft, not provide enough support for our spine, which causes us to basically sink into these weird positions and causes a lot of pain in the back and the hip. And if your pain is worsening, this could be a good sign that you're actually having less support than you did previously and is a good sign that maybe a more firm bed could be right for you. Again, going off the tangent of support, if the base is actually sagging or it's been used a lot and it has basically like little bumps, different areas that you've been sleeping in, that can actually cause an even worse lack of support, and the mattress will actually fall into these and cause more issues than just a poor mattress will. So here are a couple different types of mattresses to consider. So memory foam mattresses are probably the best one for relieving pressure and are praised, as we know, for previous years for helping relieve some sorts of pain. Now latex mattresses are a little less popular, but really help to distribute weight evenly and can really help relieve pressure on the joints and the likelihood of developing low back pain. Now, innerspring mattresses are a little bit different as well. These have coils that basically help us to distribute the weight a little bit more evenly as well. The whole point of all of these really to help distribute weight and not have pressure points throughout the night. And lastly, a hybrid mattress, which is actually the one I have myself, is a hybrid between latex and supportive coils, and this one kind of provides a mix of the two. The coils being a little bit more supportive in my opinion, and the latex being a little bit less. This is a good mix and I prefer this one. So a couple frequently asked questions: how do I know if my new mattress is causing my low back pain? The one I like to use mostly for this is the timing of your back pain. If you have pain when you're lifting, it's probably from lifting. If you have pain from a long day of work, it's probably from working too long. But if you have pain after waking up or pain during the night, oftentimes this can be caused from a mattress issue. Keep in mind that we want to kind of look at the timelines here. So if your pain started the week after you got a new mattress, this is a good sign that you might want to be looking into some alternative options. How long does it take to adjust to a new mattress? So like we said before, around 2 to 4 weeks is a great timeline to look for as far as seeing if your back is adjusted and the mattress is adjusted, to see if this is a good fit for you. If it's not after a month, that's a good timeline to say, okay, I've tried this mattress and it wasn't a good fit for me. How do I know if the mattress is too firm? A lot of people that have a super firm mattress can feel it's just not comfortable and they can't sleep due to the comfort aspect. And while it might be supportive, it might cause numbness, some sort of more tightness, even more pressure points. This is a good sign that it might be too firm for you. Is it normal to sleep bad on a new mattress? Now there is some sort of time, 1 to 3 weeks, where your body's adapting and it's getting used to sleeping on this new surface, but after this point, then it is not normal after. Thank you guys so much for tuning in to Early Bird by Amerisleep. If you did find this information helpful today, be sure to visit our blog for more helpful expert opinions and information on how to get the best sleep of your life. Until next time, sleep well and take care.